drug corruption of the central institutions of society on a massive scale.
This is drugs. This is your brain on drugs. Any questions?
Over 65 Americans only account for 14% of the nation's population, but they use more than 30% of all prescription drugs, including some highly addictive painkillers.
An interesting question is, if people are prescribed cannabis, does that have then an opioid sparing effect? Because again, for chronic pain, we do use opioids, Vicodin and drugs like this.
So you mean, could it replace?
So could it replace or lessen the requirement? We need studies to understand that, but I think the preliminary evidence suggests that may be true.
UGA researchers looked at 17 states that had legalized medical marijuana as of 2013 and 9 different medical conditions. The conclusion, marijuana use saved Medicare more than $160 million in 2013 and could have saved almost triple that had it been legal in all states.
When marijuana becomes a medical option for people, then their use of prescription drugs falls.
David Bradford is one of the authors of the study.
We think that the only plausible mechanism is that people are shifting, at least in part, towards using marijuana as medicine.
There is increasing evidence that cannabis is helpful in the management of certain kinds of pain.
And it's the kind of discomfort experienced by seniors, like sharp pains felt by nerve damage caused by things like chemotherapy or diabetes.
There is very little education, formal education in medical schools, in nursing, in pharmacies, as it relates to the screening, evaluation, and proper treatment of patients with chronic pain. Are there not already many education material out there? Yes, there is significant educational material out there, but many of them have been funded through subsidy from pharmaceutical companies. And I think that one of the concerns has been to what extent there may be some conflict, whether that in turn affects the quality of the material.
As soon as we start to ask the question over 2, 3, 4 months or 2, 3, 4 years, what's the effect? I don't think we know the answer to this. And that's largely because it hasn't been looked for very carefully.